Thank you so much for that question. And thank you for having me today. My name is John Paul Omollo. I work for PATH. PATH is an INGO with a large presence in the African continent, where we support and partner with governments to strengthen the health systems. Our main values are working towards strengthening the health system and making sure that through innovations we are able to reach the most marginalized population within the geographies where we work, with special focus in lower middle income countries. And to your question, what are some of the challenges that we're facing with what I would call substandard and falsified medicines? In Africa, the regulatory landscape is quite porous and a bit layered. So because of the weak regulatory system among some of the African member countries, it makes it very easy for the substandard and falsified products to easily circulate within the continent. Some of the studies by WHO indicate that about 42% of the products, pharmaceutical products that are circulating in the market, are either substandard or falsified. So we need to strengthen the regulatory landscape and regulatory environment for medical products. And how do we do that? Number one, we need a very strong legislative environment within each of the countries. And those countries need to have adopted the African Union Model Law of Medical Products Regulation as a bare minimum. That way, we will be able to guarantee the strength of the regulatory system at that country. Secondly, we need to make sure that our regulatory processes speak to each other and we're able to apply the principle of reliance among member states. That way, then we would be able to rely on the, the dossiers or the reports that are given by other regulators. And thirdly, we need to make sure that each of the countries, 55 member countries, are able to ratify the Africa Medicines Agency, which is our supra authority when we're talking about regulatory harmonization within the continent. That way, we are also going to reduce the circulation of substandard and falsified products. One of the biggest impact of this substandard and falsified products, of course, cuts across several things. One is that it affects the market and reshapes the market, skews the market in favor of the substandard and falsified products, and that therefore kills innovation. It takes away the market from the genuine products that needs to get into the market. It kills the innovation that would have come into the market out of the new products that people are working on, because you cannot compete with something that costs way cheaper but does not work. Again, in terms of the health impact, a lot of the times they would result into adverse reactions to the patient. It would result into people not getting well, which means longer periods of illnesses. Or thirdly, it would even kill or even cause disability. And that means we generally within the health, we lower, that product is lowering the quality of life or even causing death to the patient. Call to action, two things. One, we need to bring the action where the issues are. So that means we need to start producing the medical products within the continent, and we need to strengthen the manufacturing ecosystem within Africa and make sure that that the products that are being produced are of quality, are efficacious, and they are able to address the needs of the African population. And secondly, is that we need to make sure that the regulatory harmonization is really every member country strengthen the regulatory landscape and ecosystem within the continent. And each of these member countries needs to make sure that they ratify the Medicines Agency and also adopt the AU model on medical products regulation. Thank you.